Hi, my name is Sam G. I'm the sales manager at Hague Dental Supplies. This is my colleague James Fletcher, project manager, also at Hague. We're here today at 52 Harley Street, one of the UK's leading dental practices. We're here to talk about our experience working with the two founders, which is Adam Thorne and Mark Hughes, and how we went about helping them design and open up this wonderful practice.
We started on Harley Street in 2004-2005 with a small two-surgery practice that then grew over the next 5 to 6 years to 2 locations, both on Harley Street. This was operationally inefficient, and we wanted to create a centre of dental excellence. So we found 52 Harley Street, and where we're now based. Because of the centre we wanted to create, I approached Hague Dental for their assistance and to really develop the project. We started about 8-9 months before we opened, and they came in with the planning that helped direct the building works, to contacting the suppliers, to really installation, and to make sure that everything runs smoothly as we would try and do for a centre of clinical excellence. The challenges we faced were to create a warm, welcoming environment with high-end technology and equipment, yet in a comfortable environment in an old Georgian terraced house. The building is over 6 floors and 4,000 square foot, and we completely gutted the building, worked with Hague Dental and our architects very closely to create an efficient workflow that's warm, welcoming environment to patients, and yet maintains high clinical standards.
Because of the tight and precise timescale that we had to work with, the project management side of things was a key service that we had to deliver to both Adam and Mark and the entire practice. Of course, we do a lot of projects from single surgery practices to multi-surgery practices, and 52 certainly presented itself with its own unique set of challenges.
My main involvement was to do with sort of the layout of rooms, and heavily to do with the decontamination room, and working alongside the main contractor to ensure our sort of requirements were met from cabinetry and equipment point of view. We obviously had to work within boundaries of CQC and HTMO 105, and I think we achieved that to the level of best practice. And because although we're doing this day in, day out, different areas ask for different sort of requirements. Initially we had planned to have one compressor feeding decontamination floor 1 and 2, and then the second feeding the future 3 and 4. What actually happened, because the compressed air pipe was running early in the project and it was all obviously chased into floors, etc., it was all done one feed to all floors. So what we had to do was still work with the 2 compressors, but they would then both just feed the entire building, and if one went down, the other would be the backup on that side of things, which works absolutely fine. Although it wasn't the way we planned it, it still suits, and it still works absolutely fine.
The storage also was very important from a growth point of view, because of the practice at the rate that it's grown, going from 2 chairs now up to 9 clinical chairs. The storage was really, as James said, a big issue, but one we were able to come around by designing and installing individual storage units within each of the surgeries.
And then we arranged to get a representative from A-dec and a representative from W&H to come in and do the training on their products, which we got some very positive feedback from.
Sam and I are here 6 months down the line from opening. Dream practice has been delivered. We are very excited. We're still growing and going from strength to strength. I was most impressed with Hague from all aspects of the development, from the initial planning, supplier selection, installation and training, but still we maintain a fantastic relationship together. Sam and James and the team really do support us on our day-to-day operations. Of course there are sort of certain things with equipment that needs maintenance, and they are there literally the other end of the telephone if we need them.
Yeah, it was a dream project for us. Really pleased with how it worked out. We pop into the practice, both myself and James, on a frequent basis, just to see how everyone's getting on. And as Adam's touched upon, we're still offering an ongoing support and service with our engineering as and when needed from an account management point of view. So looking forward to see what the future holds.